certainly as we answer some more questions are raised. And, as you said, Rich, I think we need more data. And speaking of more data, Riyadh, as you look at these systemic agents, you see that we have high level evidence changing probably the natural history of advanced liver cancer. Where do you see these drugs going in the future and how we manage patients?
Boy, I mean, like you mentioned before. I mean, there's so many new advances over the last year, and these are all great things for patients. I do think, as you highlighted, though, it makes certainly in the advanced setting the decision making once you progress to the first line quite tricky. I would think that at some point a refinement of staging system might be in order, particularly now in the advanced setting. So now not only do we think that the BCLC-B stage needs to be refined, maybe there are certain Cs, the pattern that they progress, the location of the disease, et cetera. Maybe there are things that we could use to better identify which patient is going to respond to this type of treatment. I think obviously it's clear based on the number of treatments, a lot of patients are going to cross over from left to right, but right to left, right? You're getting great responses now. So now all of a sudden, particularly with some of the IO combinations and some of the LRT combinations, now you have exceptional and spectacular responses. Now we, in fact, at our center have resected people that had advanced disease with metastatic disease. They've now been downstaged and demonstrate such a good response that we represent them and move things to earlier, and now all of a sudden we resect them. And so I think it's going to require a lot of sort of rethinking as to the algorithm with which patients are treated. And obviously combining these things is going to be very, very important. Now, how that's done, again, I don't really know. But again, downstaging these patients, to resection and to transplantation is something that previously we would never think of. But now all of a sudden, we're seeing these great responses that make you think way outside of the box and really represent what I think is true individualized care, right? A patient responded so well, we'd never think of resection in this setting, and now you're going to resect them.
What about the combination of TACE or local regional treatment and these new systemic treatments?
Yeah, I think that's the natural way to think about things. We know that local regional therapies have a limited benefit, right? They're going to progress anywhere between 6 and 15, 18 months, depending on the study that you look at, which means they're going to get something else. What that something else is, again, I leave that up to you guys in terms of best selection in the advanced setting. But the natural tendency and the academic and intellectual curiosity is, how best can I benefit from both things? How can I do a really strong cytotoxic therapy and use something that's cytostatic and get a long TTP and a long PFS and prolong the duration of response? So the natural tendency is to figure out a way to mix these two things, because I want my BCLC-B patients not to live 25, 26 months. I want them to live 50 months, 60 months, and 70 months, right? That's what I aspire to. And so really the curious thing here is to how we can combine them in the proper patient in the earlier setting.
Yes, and there's a lot of exciting studies looking at all the combinations we touched on today, or most of them in combination with surgery or ablation as true adjuvant studies, or in combination or to support local regional studies. So still, I think it's very important that we refer our fit patients for clinical studies, even if they're candidates for standard of care. The only way we'll continue to move forward is with research.
Yep.
But this has been an excellent discussion. I'd like to thank my colleagues for joining me today. We hope that you found the information to be valuable to your clinical practice and welcome your feedback on what we covered here today. Thank you all for watching this On Live News Network broadcast.